Hello participants of the Global Health Leaders Conference. I'm Kimia, a student at Winston Churchill High School, and today I will be presenting on lifestyle habits and type 2 diabetes, educating the public to prevent the spread. Before we begin, here's a little bit about me. I'm a rising junior at Churchill High School. I'm almost a black belt in Taekwondo and have just returned from the AAU National Championship a couple weeks ago, where I won gold in 2 of my events. I love music and I've been playing piano for the last 11 years. In my free time, I like to volunteer and have volunteered at my Saturday school, Taekwondo studio, and as medical staff for 10Ks. I also love being involved at school, where I'm the elected treasurer for junior year and Science National Honor Society treasurer. I'm also the president of the book club and a club officer for DECA and the Women in Business Club. I've had interest in biology ever since taking it as a course in school, and I'm interested in pursuing medicine in the near future. I have specific interests in endocrinology, which stem from meeting with and learning from my own endocrinologist, and my interest in diabetes was sparked by what I learned through her. In my presentation today, we'll be going over the following sections when discussing type 2 diabetes. So what is type 2 diabetes? Scientifically known as diabetes mellitus, type 2 diabetes is one of the 2 subclassifications of diabetes. Being diagnosed with type 2 diabetes means that either the pancreas does not produce enough insulin or cells in the body do not properly respond to insulin, so the body is unable to maintain the blood sugar levels at a healthy standard, as insulin is the hormone produced by the pancreas to convert food into energy and to manage the body's blood sugar. Type 2 diabetes is not a curable disease, however, treatment exists in the most common form of insulin injections. Causes of type 2 diabetes vary, but 3 of the major causes are family history, lifestyle, and obesity. Here are some of the relevant statistics about type 2 diabetes that show just how large it has become in today's society. Approximately 537 million adults live with diabetes as of 2023 in the world today, and of those, 90% are cases of type 2 diabetes. This number is expected to increase to 643 million adults by 2030, which gives an increase rate of about 19.7% if no immediate action is taken. Classified as a global epidemic, diabetes can cause blindness, kidney failure, heart attacks, stroke, and lower limb amputation, making it a dangerous disease if not well maintained. What makes type 2 diabetes a global health issue? As seen in this graphic, diabetes is a global health issue because it affects all regions of the world, with high rates in every region. Type 2 diabetes can have devastating impacts if left untreated, and in 2021 alone, both type 1 and type 2 diabetes were responsible for 6.7 million deaths. While it is present everywhere, many areas are affected to a much higher extent. This disease is especially prevalent in low-income countries, and in 2023, 3 in 4 adults with diabetes live in low-income countries. So what is the relationship between lifestyle habits and type 2 diabetes? In a meta-analysis conducted by researchers from China, 16 studies were used to analyze the relationship between multiple risk factors and type 2 diabetes incidence. The risk factors included smoking, alcohol drinking, diet, physical activity, obesity or being overweight, and sleep duration. These findings from the analysis concluded that those with the healthiest lifestyle, for example, non-smokers and non-drinkers who are regularly fit and practice a healthy diet, hold a 75% lower risk of contracting type 2 diabetes than those that live a sedentary lifestyle and practice unhealthy diets. Another finding was that 2 factors had a significant impact on the likelihood of contracting diabetes: smoking and being overweight. Smokers have a 37% higher risk of type 2 diabetes than non-smokers, and overweight individuals have a 131% higher risk of type 2 diabetes than those that had a regular weight proportional to their dimensions. But promoting a healthy lifestyle is impossible without the presence of an educated population who understands the significance of maintaining a healthy way of life to prevent diabetes. In a systematic review, medical science researchers looked into 19 studies, including 16,106 participants who did not already have any form of diabetes, and found that the use of community-based educational interventions helped reduce diabetes incidence by 46% overall, meaning there is a direct relationship between diabetes education and type 2 diabetes incidence. So what is the greater issue? Several countries, especially middle and low-income countries, deal with a lack of diabetes education, which has negative impacts on the growing population of those with type 2 diabetes. For example, in places like rural India, we see a lack of diabetes education, and it's been found that individuals with lower income and less education are 2 to 4 times more likely to develop diabetes. This is why the spread of diabetes education, specifically to where it is lacking, is imperative to help prevent the spread of type 2 diabetes cases worldwide. However, education is just half the battle. It is important to add that even while educating the public has massive impacts, many populations require action to be taken as well. My proposed idea are catered intervention programs, which serve to address the higher type 2 diabetes rates in low-income communities by assessing what changes could be made to those communities. There is no one blanket solution to prevent the spread of type 2 diabetes everywhere. So we have to decide intervention programs and trainings that fit specific regions and their communities to make them effective. Depending on what the region is, a certain community may require new gyms or recreation centers, or rather grocery stores that are within range, and food stamps to use at said grocery stores. The need for this sort of intervention is because of the disparities that many regions face around the world. An individual's community has major impacts on their lifestyle, and by acknowledging the disadvantages that lower income communities face, we can address the problem even further. For example, in the Western Pacific territories, there are 206 million cases of diabetes, which is greater than in other regions. In these areas, the increase in diabetes cases is stemming from the rise of childhood diabetes due to a change in lifestyle that comes with the rapid urbanization and westernization of several nations within the region. Using this information, intervention can be targeted at the elementary level to help slow the rise of diabetes cases and be customized to the issue at hand. This intervention customization can be done using big data and AI analytics algorithms, which can be used to find the patterns given the statistics and data of each region. By doing this, we can analyze the big factors of each region, like the socioeconomic and geographical aspects, and use that to design intervention programs that fit each community. The actual programs themselves can then be implemented and funded by the respective government. This sort of intervention is crucial to mitigate the impact of this epidemic on individuals worldwide. Diabetes education is a topic that's being tackled at the governmental level in many nations. However, it is an issue that we can take into our own hands, and we can have positive impacts with small actions. The biggest thing anyone can do is spread what they already know. An effective way to spread diabetes education and awareness is through starting a school club, where you can educate members, create resources, and organize fundraisers. You could also make a change by utilizing social media to spread diabetes education via platforms like Instagram, TikTok, and Facebook. Another amazing way to spread diabetes awareness is by joining or donating to diabetes-based organizations such as the International Diabetes Federation and the World Diabetes Foundation. Lastly, you can always reach out to local governments or your local board of education to make changes where they may be needed, such as adding diabetes education to health curriculums or creating public resources for the community. So in this presentation, I was able to go over what type 2 diabetes is and how it is a global health issue that impacts several populations worldwide. I also covered the importance and impact of lifestyle habits and education both, and how they impact type 2 diabetes. We learned that many communities have low education and resources to properly make a lifestyle change, which is why targeted solutions are needed to address the inequalities worldwide. And it is always important to realize that everyone can make a positive change. Thank you for listening to my presentation. I'd like to acknowledge my family for their support, Dr. D'Souza, my endocrinologist who inspired this presentation, and the Global Health Leaders Conference community. These are the references I used, and if you have any questions, feel free to reach out. Thank you.